everyone, and welcome to another episode of Awkward's Anonymous Conversations on the Right to Pleasure. I am Vance, and I would be your host for today. And I'm very excited because for this episode, we will be talking about something that I feel passionate about and something that I've been working on, the importance of incorporating pleasure into policies, because we know all our advocacies hopefully would lead to policies so that it would be sustainable and long-term with government support, which is somehow sometimes lacking in our country. So I'm very happy because today I am with three advocates, champion feminists, young feminists from different countries in Asia. I actually met them at a conference few months ago. And while they are with their different organizations at the regional level in their country, I know for a fact that these three young feminists are actually working on SRHR because they are also equally passionate on the issue and they are here. I invited them as my friends. And thank you again to these three lovely feminists for accepting my invitation to join this podcast. And they are here as individuals while they are also part of multiple organizations with their professional and advocacy capacities. All of our views in this discussion would be of our own and does not represent any of our organizations unless otherwise stated. Again, thank you and welcome to our episode on Awkward's Anonymous Conversations on the Right to Pleasure. So I know you're excited, so I would want to introduce the three guests for today. Let's start with my friend from the Philippines, Shif.
Hi, Vance. Hi, everyone. I'm Shiprah Belonguel. I'm a feminist activist and writer-researcher based in the Philippines. I work with Vance on a number of research projects, and I'm really happy to be here. I'm also part of Young Feminist Collective with Vance, which is an informal network of young Filipino feminists. And I'm also working as advocacy officer for an INGO called FES Feminista, focused also on sexual reproductive health and rights.
Thank you, Shif. Wonderful. And I'm sure you have so many sharing for our discussion today because it's also very much aligned with what you've been doing in your different line of work. So thank you, Shif. Now let's have Shelani. Hi, Shelani.
Hi, thank you for that great introduction. I'm very happy to be here today. My name is Shelani Palihawadana. I come from Sri Lanka. I am a feminist activist and also a lawyer by training, although I don't practice law actively anymore. I have been working around the areas of sexual and reproductive health and rights and gender for quite some time now. I still work as a capacity builder and I go across different regions in the country to build capacities of young people and other, not just young people. It could be anybody who's not young, belonging to different communities that don't typically get access to SRHR information and services. And I do wear quite a bit of hats, but currently I am co-leading the operations of a small NGO in Sri Lanka called Delete Nothing, working along responding to online gender-based violence and research around the topic. That's me, and very happy to be here with all four of you.
Thank you, Shelani. Really exciting background also and work in Sri Lanka. Now from Philippines to Sri Lanka, let's move to Riju. Riju, you're based in Nepal, right?
Yes, that's right. Hi, everyone. This is Riju Dhakal, and I'm based in Nepal. I've been a youth activist for the past 6 years now. And I was also leading a very popular youth organization in Nepal called Yuva, and we worked on sexual and reproductive health and rights extensively. And now I am involved with Arrow, which is a regional resource and research center for women. And I am so glad to be here with such fierce young feminists from the region. Thank you for having me here.
Well, thank you to the three of you, and I love it. Yes, I agree. We are a bunch of fierce advocates from the region, and I think it's important. I just always look back to our side discussions when we were in Benin because I think it's important that we have young voices, youth voices, when we talk about SRHR. Now, I guess I'll begin with a question that we ask all of our guests because we believe the personal is political. And when we talk about pleasure, there's always, unfortunately, shame or stigma tied to it. And I want to hear your story or sharing on how shame and stigma around sexuality and pleasure is something that we all grew up with. Anyone can jump in. And it doesn't have to be your experience and personal experience, but something that have been present in our countries from the Philippines, Sri Lanka, and Nepal.
You can jump in.
Sure, yeah.
So, yeah, I studied in a convent school, and it was an all-girls school in Nepal. Whenever we really didn't have much of sexual education when we were studying, but since it was an all-girls school and convent school, we were a bunch of very curious people. So we kept delving into conversations that took us to sometimes our teacher's desk, sometimes to our principal's desk, asking, what nonsense are you discussing? What nonsense are you talking about? And all of that. And there was this one conversation that I very heartily remembered where we talked about pleasure. We really didn't know the term pleasure in terms of sexual rights back then. When we thought about pleasure, to us, it really meant men, because we really didn't have an idea that female pleasure is something that we could look into or that was even existent or anything like that. And then it used to be a matter of laughter for all of us, and there were jokes circulating around. And then with pleasure often came masturbation, sex in general. That understanding was really ingrained in me until very late. And then when I started exploring myself into this field and exploring my body, and then learning about all these sexual rights and all of that, and then I got to understand how different things have been, how differently I have been narrated the whole idea of pleasure and sexual rights. So I keep thinking to myself that if this was an opportunity that I had when I was smaller, when I was a bit more of the age where I was very curious, I would have understood my body better. I would have made better decisions, and that keep coming back to me. And that's also where I actually started talking about comprehensive sexuality education and why it should focus on the students and young students.
Thank you, Riju. I actually resonate so much with your sharing on how we beat ourselves up because we think what we're doing is like a bad thing or something women or girls should not be thinking about. And that actually impacts our decision because we always think it should be for the pleasure of men and not our own. And I think so many women are still at a loss in exploring their own sexuality because of it.
Yeah, I totally agree to that.
Thank you, Riju. Shif, you might want to also share your experience from the Philippines, growing up in the Philippines.
Thanks, Vance. I'm pretty sure this is not like a unique experience. I grew up with a very kind of fundamentalist Christian family, and I suppose Philippines is majority Catholic. Other people will have similar experiences, but yeah, I can't really speak to a specific moment, but I know that sex was a very difficult topic. Like, people did not want to talk about it, but you could hear from there'd be a lot of like moral judgment around the way certain types of people engage with sex. Yeah, I can't really speak to a specific instance within my family context, but I remember in school, and this is why it stood out, is because, you know, a lot of things, like you hear a lot of things from your family, but I didn't expect it in this context where someone had told me, because at this point I was in university, I had a boyfriend, and people knew about us. And the school administrator told me, be careful or you might get pregnant. And it didn't register to me in a way that it was like out of concern. It felt like I was being slut shamed. And until now, I try to think back at that comment and wonder if, because I think you have to read things in context, right? I think it hasn't been until recently that people are more open about these things. And you still have like very kind of puritanical ideas around like sex and like marriage. And especially then. And it's funny to me now because 10 years later, everyone is asking me like, when am I going to have children?
Now it's the opposite, but it's still about control.
It's exactly, that's what I was thinking. It's young people and young women especially can put themselves in situations where, yeah, it's possible that they exercise their sexuality, and then you get a certain age and there's a script and it tells you, oh, you should already be doing this, but also it has to be in the context of marriage. It has to be in the context of bringing a family into the world. So I feel like it's very restrictive, heteronormative, and all of that. And yeah, and I think pleasure and the way and having a positive outlook on sexuality generally helps some of those boundaries. Like I feel, because I have so many friends, like women like myself and queer women as well, also just everyone from diverse gender and sexual orientation, being able to talk about sexuality and pleasure and in really the most candid way. I think that's super helpful for me, and figuring and realizing I don't have to subscribe to any script or expectation of me, because I'm, for other people, right? Like for all intents and purposes, like a cis woman. But I feel like I could actually like queer my life.
Yeah.
Yeah.
And I think it's always so much harder for women and queer and gender diverse people compared to like men talking about pleasure. The burden, the shame, and the stigma is always on us. And I think we have to normalize talking about it, which is exactly what we're trying to do now. So I think that helps in terms of being comfortable in talking about our bodies without shame. Shelani?
Yeah, I actually relate a lot with what Rizu shared on how her school and the young age, like when we were still students at schools, that experience. I was also going to an old girls' school with. So the thing was that in Sri Lanka, it's a public education system, and then all of us would have access to textbooks with information. But by now, we see some information around, but at the time when I was a student, we did not have anything beyond the reproductive system in our textbooks. So nothing about pleasure, nothing about sexuality, and we were even banned from reading romance novels. So I remember like one time, but our school library had like really an extensive of collection of books from like people who passed out or like people who migrate, like, donate like the entire collection of books. And of course, some books fall through. And I used to be an avid reader. I still am. And I came across the book Gone with the Wind, which was like a hefty book. So back then, the bigger the book was, the better it was for me. And then I was so confused. I was about 14 or 15 about it. It's like a very sexually, I would say, it's a very graphic book in terms of sexuality. And that was like my first experience reading about certain things. And I was like, it felt so good at the same time. It also felt so wrong for me, because for the entire life, I've been conditioned to think that it was like a non-existent emotion, non-existent feeling for me. And I enjoyed it thoroughly. I enjoyed it. I was so scared. And I stopped reading it after a while, because even though it's so, like, it was really good. And a lot of things I didn't understand also what was happening. And so that was like very defining for me. Oh, these things exist. What are these things? Then again, like I remember still, like, if it was like a romance book, there was like with like a girl and a boy, because at that point it was again grew up in a very heteronormative background. So a girl and a boy, if the book cover would have something like that, it would immediately be confiscated by the school's prefect. We used to have newspapers covering it and then say, this is a new book, we don't want to damage the cover, and then bring books like Bridgerton to school and then read. And buy books with a very graphic sexual content. So that's how we explored. But then it took us a lot, for me, a long time until I passed out from school. I was well into my adulthood, in even early 20s, to really understand what sexuality is, how all of these fall into places. For me, reading those things felt right. But a lot of those books also are they are definitely not accurate sources in certain ways to explore certain things, because a lot of it was very patriarchal, again, heteronormative. and cast women in certain roles to be subservient and be this and that, and pleasure is not something that they could get on their own. It's something that always a man had to give them. So all of that, it took a while afterwards also to unwind. But then I remember I'm forever grateful for that book and whoever the person who donated that book, even mistakenly to the school library, for opening my eyes.
I was laughing and I could relate because when I was in high school, I really felt I didn't have any strict religion growing up, but I felt, is this a sin that I am experiencing? I am having this kind of like feeling of pleasure when you watch something and you have this different intense feeling that you're feeling, and you're thinking to yourself, oh no, this is bad because we were taught it's bad. And I think it always goes to that discussion of how our country situation with so many with so many factors affecting how we are brought up, why we came around thinking this is wrong, why we are policed, why we are slut shamed because of our current environment. And I want to ask, because we have 3 countries here, what are the current barriers in our countries when it comes to achieving SRHR-J? I guess Shif and I can begin. The Philippines is not a good example of realizing SRHR. We don't have divorce yet in the country. Abortion is illegal. Minors, adolescents are not allowed to access contraceptives without third-party consent or their parental consent. SOGI, SC, is not yet defined by law. It's not acknowledged. So there's discrimination when it comes to your preferred gender identity. You're invisible. No, you're not just invisible. You are discriminated upon, against, and you don't have any form of protection for your right to your gender identity and expression. Shif, you might want to add what's going on in our country. I couldn't say we have a good example aside from the reproductive health law in 2012 that is not yet fully realized even.
That's true. Thanks so much, Vance, for that. Yeah, we do have the responsible parenthood and reproductive health law, which is our country's main framework for implementing SRH policies and programs. And yeah, like you said, a lot of the elements of that reproductive health law isn't fully realized. You have comprehensive sexuality education, which honestly, I'm not sure has been fully implemented, because as of a couple of years ago, they were still piloting in schools. You have post-abortion care that's obviously not fully implemented, or I don't think there's a lot of political will around having aggressive guidelines and implementation across health units. And yeah, and I think just also the way we're looking at, for example, contraception, while we have programs for that, it's not really like available for everyone for the most part. Like, people will go to pharmacies or private sector providers to get their contraception. Yeah, there's a lot to be done.
Yeah.
And I think obviously if you look at the issues that aren't legislated at all, like abortion, so GSC, divorce, like you mentioned, you would think social norms really have a huge part. And I think that's true, but also that there is such a strong lobby from the Catholic Church, its followers, its supporters, to prevent like a lot of progressive bills from passing in the House and Senate. I feel like even for many Filipinos, like, our policy framework is just too extreme. A lot of people suffer, for example, from intimate partner violence in the context of marriages, and we know that there are issues around incest, rape. A lot of these laws could go a long way towards addressing these things, and I feel like or on some level, many Filipinos have that sense, but like, why are our laws so restrictive and so extreme? I think I read recently that around like 10% of the population identify as belonging to LGBTQIA identities. And like, in my head, how is that possible? And we don't have a SOGSC an equality or anti-discrimination bill, right? Yeah, so there's really some level where we have to say vested interests.
Yeah, the
supporting
political
this.
sway.
Yeah.
I believe of the political sway on how politicians, elected officials are too scared to advocate for something because of the threat of elections. It's very unfortunate because you cannot legislate people's bodies based on that. But yeah.
Yeah. My 2 cents on it. Also that Filipino activists should also be more vigilant at this kind of at this time, at this moment, because even before, I think a lot of religious organizations at large already have connections to like international organizations, but that I feel like they're becoming much more coordinated now. And so we can expect like a lot of support to go into kind of progressive legislation like lobbying. So yeah, so we can expect that because now that these things are being talked about, and I think there is some level of public support, they're gonna be the opposition or these anti-rights people are going to be more aggressive in terms of their lobbying and mobilizing against against an SRHR agenda.
That's really scary because they're also a well-oiled machinery. But before we talk about further why we have these barriers, let's see. I'm interested to know if Nepal and Sri Lanka are how they're faring in terms of rights and SRHR. Because I think Philippines is so much backwards, but I don't know if you can also relate to the policies that are still missing. We can start with Sri Lanka, Shelani.
Yes, we have, I would say to a certain extent similar problems than Philippines, but also different problems as expected. For us, in general, the health system, it's a public health system in comparison to other countries in the region. This is something that we get wherever we go to regional forums and when we share. Like you do have, I remember like a really like a renowned scholar when we were discussing how we have problems. What do you have to complain of? Your statistics are the dream of like my country. But then I went back home thinking, but it's not that. It's like the ground situation is so much different. So just because we do have a public health system and we have like lowest maternal mortality rates, those very much like you shared earlier, Shebana, you can't legislate bodies. And there are a lot of things that the legislations or the public health system fail to capture. Specifically when it comes to sexual and reproductive health and rights. You can't measure that by looking at low maternal mortality rates or like how many like the low rate of teenage pregnancies, because we do have really high rates of teenage pregnancies in certain districts. In maybe like urban districts, if you have a low rate, when you really look at the entire country, it's a low rate. But in less developed areas, it's really high. And so that rosy picture that the system or like what we show the rest of the world is not really the thing. And while it's really good for everyone to have access to, on paper, everyone has access to free contraceptives and free healthcare and clinics. That's not the case in most areas. People don't know that they have access to, if they go to a medical health officer's office in their region, they can get access to condoms or any other long-term contraceptives. They don't know. And a lot of things are so medicalized. And information, like if it's contraceptive-related information, if somebody who's not a medical professional goes and delivers, like for example, myself as a peer educator, if I go like that, sometimes like now I have come to a level where like not a lot of people question me because I like always scientifically back and go to really like find details when I explain things to the audience depending on their knowledge level. But it's always questioned, like you are not a doctor, how can you tell these things? But some of this information that anybody can understand, read and access and then make an informed choice. So that medicalization is something in our system, is something that really worries me. And then implementation of, there are a lot of policies that are there, which it can't really go into the last level of the really effective implementation because there's no access to knowledge and information is a really big barrier. And specifically when it comes to certain communities, Sri Lanka is a deeply racially divided country. So the majority population they have the language that they like, majority of the country speaks that language. So they have access to a lot of things. But minorities don't have that same level of access to resources, and just based on the language, sometimes they get discriminated and they face a lot of judgments. And because of there are other I would say, problems that are there in the society as a result of certain incidents that happened in Sri Lankan history. Like we had a civil war for 30 long years. And then in the north, we have a lot of female-headed households. And a lot of prejudices that we have in the society, men having to lead a family and then providing for the family in female-headed households, even though on paper you can have access to contraceptives. So healthcare service providers do not give access to contraceptives for these women, saying that your husband is dead. Like, why do you need contraceptives? A lot of problems are there in those levels, attitudes, access to information, like those, all of those compound into something bigger. So it's what the statistics don't show. There are a lot of underlying problems that we have to address, and what we see in paper, like policies, really need to change and address certain things and look at other ways of getting information across, and look at ways to make sure that certain information trickle down to the lowest levels of the grassroots, and also for healthcare service providers just to basically give them accurate information and good education, like on value clarification on how they should provide services without judgment.
Yeah, I think that is very important. I'm trying to now. I believe, of course, this is something that we know, but sometimes we may forget that it's not just because we have this law already, so we're good. But that's not a full representation of the reality in the community. If while you can access in the Philippines, if you're 18 and above, then you can access contraceptives through the rural health unit. But then what is the quality of service that is available to people? If I can access contraceptives, but I would be judged because I'm unmarried, while it's there, it's not right. It's still against our SRHR if I am discriminated and judged because I'm unmarried, for example, and needing contraceptives. So we still have to remain vigilant. And I actually am taking note of several recommendations Shif and Shelani already shared. But let's look at Nepal, Riju, in terms of policies and situation in the community and women and gender diverse people in terms of their SRHR. How is Nepal faring?
I don't think I'd bring in a very diverse perspective to that. Talking about
I think it's also telling that we are seeing the pattern of how the situations of like women and gender diverse people are in Asia.
And also the fact that this has been a very long fight and it has come down to generations and it's again passing down to further more generations. I think it's a time when we're already like, nothing's happening. But anyway, so Nepal is apparently one of the most progressive states in the region, and our progression comes along our signatories all around, our ratifications, also our documentations of policies, acts, and all these kind of things. And we actually boast ourselves for the kind of laws that we have, including for comprehensive sexuality education, since it's a part of our curriculum, for safe abortion, since, it's also legalized in Nepal, even for the rights of gender diverse people, they're recognized in our constitution. And very recently, even the Supreme Court has given an order that there should be a mechanism to register same-sex marriages. And then following that, there have been different other developments in the country as well. Our primary health system recognizes contraceptive services reproductive services in general. And adolescents are a big part of our national health and development strategy. All these things are very prominent in terms of what Nepal promises to have. And we are definitely trying as country, as health service providers, as educators to excel in the areas that we've promised to as well, because we've always seen that it has been receptive of the different recommendations it receives at international platforms as well. But where the barriers lie is actually really at the service seeking level here. Even though most of our health facilities are supposedly to be adolescent-friendly health facilities, we still lack that training, that candor, confidence of delivering such services, or that behavior of seeking such services, or the significance of those services. And there's a gap in between the awareness that it is among the health workers and also among the health service seekers as well. And on top of that, our system is very much focused on reproductive health, right from comprehensive sexuality education curriculum itself. So when we have curriculums based on anatomy, on HIV, on STIs, then we really claim that we're encompassing topics of CSE, but we really forget the aspect of choice, of confidentiality, of consent into those curriculum, or even while delivering these services. And a large part of sexual rights is derived by the very movement of choice and confidentiality and consent. And if we are missing out on that part, then we definitely need to look back as a country on what we are delivering. But in terms of implementation of the great policies that we have, there's still a lot of gaps. And Shiprah earlier said that it really depends on the political will and how it comes out translated in terms of actions by the different governments that we have. And because Nepal is a small country, we have a lot of young people already draining out of the country, and we're at a stage where we're really dependent on our aged population now. And we're also politically very unstable right now because of the rampant change of governments. So the focus, the shift, and then how we've been hit by earthquake first and then by COVID, and we're still trying to recover our economies. Nepal as a small country, we're really struggling to move our focus on human rights perspectives or going beyond that basic infrastructure delivery. And most of our young people, most of our women, most of our gender diverse people are still struggling with basic requirements like food, or still grappling with the effects of poverty itself. The government really does not have that stretch of focus on human rights perspective beyond delivering these basic infrastructures. So I think the social context of recovery is also what we're struggling with, along with the barriers and implementation of the great policies that we have right now. But I'm hopeful.
Yeah. Well, I'm hopeful because you mentioned a while ago that we have to start also raising awareness among health workers, government, etc. I am hopeful because now we're actually focusing on adults, because young people are okay. I don't know about you, but I've seen so many Gen Zs, Gen Alpha who are very aware, very conscientized on their rights, not just on SRHR. And I think that brings me hope. But also, I want to second also how when we talk about SRHR, it's always about family planning, reproductive health. Because people always see it as still about reproducing or about families, when in fact all of us, even adolescents, should be able to enjoy their right. And agency, consent, power, control of our own bodies are very important discussions when you talk about SRHR. And Riju, Shelani, and Shif, I've heard some sharing from you three in terms of the barriers or the challenges that we are experiencing in promoting, that are hindrance in promoting SRHR policies. It's a struggle, not just in terms of convincing our elected officials, but also the general public. Some of you shared, of course, the religious aspect is important, is a huge barrier. Cultural, the norms that we have. Let's zoom in and see, why is it difficult? It's actually already difficult to talk about SRHR to advocate for our right to sexual and reproductive health. But when we bring in pleasure, it is much more difficult. Why do you think that is? Why do you think that's a problem in our countries? Anyone can jump in.
I can go ahead, Bans. Also because I feel like what Riju had spoken to resonates a lot with me in terms of where we are, in terms of our like policy frameworks. Like you said, it's very like family planning. The way even our reproductive health law is framed, right? It has responsible parenthood right before that. And then we've taken mostly a public health approach. And I think on issues related to like young people, it's also a very protectionist approach. Like make sure we prevent young people from getting STI, make sure we prevent them from getting pregnant, which aren't bad objectives per se. But I think it lacks acknowledgement of the fact that young people are having sex or exercising their sexuality. And how do we actually recognize that? And also even we don't really have a positive outlook on sexuality, and that makes it so hard to bring like these pleasure principles in the discussion, right?
Because it's never rights based. It's very difficult to just say, hey, it's their right, they should be able to do it. You have to always frame it that it is a problem and we're here to save them from this problem.
Yeah. I feel like sometimes the most progressive position we land on is the public health approach, not even, like you said, not even rights-based, not even about people's rights to bodily autonomy, their sexuality, etc. At best, we get the public health approach. At worst, we get something like a couple years ago, I went to this talk and someone from an allied agency to the Department of Health had said that the problem in Philippine society and why young people were getting pregnant was that morals are worse, and therefore abstinence is still an important thing to advocate. That's still kind of something that I guess some elements are pushing even within governments. Yeah, at best we have public health. At worst we have this really bad expression of like protectionism.
It's a messianic complex. Thank you, Chef. Shelani, do you might want to add on to that discussion on the challenges in promoting SRHR policies?
Yeah, so I think I can also pick up like a lot of what Ship and Riju shared do resonate, specifically in terms of consent when it really comes to being like implementation. My problem earlier was that whole heavy medicalization and giving priority to medical professionals, even for small things that you could really, if you have accurate information and you could make an informed decision on what you want to do. This is really like very true when it comes to certain things for women, specifically for use of contraceptives, in choices that they would make in maybe if they are going to have children, and other like how they would weave their periods, and if periods are painful, what sort of things that you can do, and diagnosing menstruation related illnesses. So that is definitely, I have a problem in that, because the one thing we are still giving like a big priority to the doctors and looking at them as we idolize them to an extent that they have a monopoly for certain things, and they are not willing to look at a rights-based approach when it comes to implementing these. Some of the challenges that Sri Lanka has are last mile challenges, and you can go clinical all you want, but as long as you don't look at it as a person and it's a rights
and a societal problem that we have,
you can't really get to that 100%. So a lot of problems, a lot of certain indicators that speak to a lot of problems are stopping or are stuck at a certain level is definitely because we don't have that rights-based approach. And in another big problem that Sri Lanka has is that other connected stakeholders, like the judiciary, for example, like we recently had a draft bill that was put forward on gender equality and women's empowerment. The judiciary is completely about 50 years behind in terms of development in gender, sexuality, women's empowerment, that bill just looked at mainstreaming gender in state service, like state sector, which would have took like a big step forward if implemented correctly or even partially. Having someone who thinks about gender, takes care of gender mainstreaming within state institutions would have like really helped. But judiciary itself pushed it backwards based on a sense of public morality and like moral panic that when you like talk about pleasure, empowering women, gender identity and expression, these are alien terms for a judiciary that is very far behind in terms of development when it comes to these concepts. And that culture, so all of that makes it really difficult for policies to be really implemented. And like we discussed, like sex, SRHR, rights are always difficult topics when it comes to societies like that. We come from very colonial backgrounds. We are still very, whether we like or not, we are still hungover from that period and look up to unconsciously, subconsciously, a lot of us look up to those nations still do, and in terms of law and everything. So all of that makes it a confusing cocktail, but like mainly the lack of definitely the rights-based approach and that attitude in a problem, and like few things on demedicalization and allowing that medical monopoly to go ahead has, in my opinion, really created. That is why it is hard for us to go further.
Thank you, Shelani, for that. Unfortunately, we are running out of time, but of course, I won't let you go until we have some recommendations. So just quickly, what are the top three most urgent things that we have to do to fully realize our SRHR and to remove the awkward in the conversations that we're having towards pleasure? Top three. Yes, go ahead, Shiv.
Right. I think I'm gonna jump off a couple of things that you and Shelani actually mentioned. Shelani saying we really have to insist on a rights-based approach. I think that's like the baseline for us to be able to introduce pleasure principles to our laws. I feel like that's the approach that makes room for already includes recognizing rights to sexuality. The other thing, and this is from you, Bans, recognizing young people. And I feel like young people are really key, bringing pleasure in the conversation, because I feel like most of society thinks that this is the constituency that needs protection, when in fact there's also like a lot of agency from young people. And I think just from the past couple of years, seeing how also the conversation has progressed in the Philippines, we haven't necessarily passed the laws we want, but we are at a point, I feel like, where there's a lot of conversation and we're really coming or showing up in numbers to support a more
at the front and center of the conversation.
Yeah. And it's young people that are doing that. It's people like you, Bans, working in policy, and others like us. I can look at the collective and already see so many people that are working on this. And that's personally that's what gives me hope that we're going to progress in terms of policies and laws. And then I don't know if I really have a third one, but I would say we also have to have a conversation around how faith and SRHR don't necessarily have to contradict each other.
There are two separate things.
Yeah. There are like many examples across cultures and different countries. There really are more progressive faith cultures and more conservative ones. And I think we have to work on building also within faith communities a more progressive outlook on issues of sexuality and SRHR. That's it.
Thank you, Shiv. Making sure it's rights-based, put young people at the center of the conversation, and finding that balance and less contradiction between faith and SRHR.
I think I second all of what Shiv just said. She's beautifully summarized it. I also feel that in our context, we often fail to integrate SRHR into the daily activities or the movements that are happening around us. Like it could be any revolutionary movement that young people are taking, but where does the SRHR come into, or where does feminist issues come into in those movements is also something that we can really look into. And we can see how the social dynamic, the power relations, these kind of things affect young people and adolescents, and these kind of things affect how SRHR services or education is affected, and that the delivery itself is affected, and that whole comprehensive system approach is something that we can take forward. And we really don't need to look at SRHR as a silo of only women's issues or only an issue of young people. It really needs to be integrated as a priority into whatever works that we are doing, is something that I feel could come into play more. And also recognizing the fact that it's a very dynamic subject, and with every other day there are more advancements in terms of evidence, in terms of medicalization, in terms of all these kind of things. It's also important that we really have data and evidence at local levels, and these data are disaggregated in terms of the different marginalizations that each of our countries have, because we all dwell into local context, and at the end of the day, the delivery of the service, the delivery of the rights is going to depend on how the local context will absorb it. So I feel like we really need to back up our system on data, on gathering local evidences, and also moving from that disease-based, preventive, policing, protectionist approach to more celebratory-based, rights-based approach. I think that shift of narrative, that shift of hope, that taking that leap of faith would be a really nice way forward. And I also don't think I have a third one. Sure, I'm so sorry.
No, it's fine. Actually, we now have a longer list from when we started. Evidence-based is very important. We have to, and it has to, I love that you mentioned how it's evolving, because some people are stuck up that, oh, during our time, it was this way and so on. But we have to accept that times are changing. Collaboration is very important, and also unpacking power, who hold the power and how are they using this power. I think that merits a whole separate discussion even. Shelani?
So I actually don't have a lot to add, because Ship and Riju both really put across very salient.
Perhaps, Shelani, aside from your top recommendation, I want to ask also, who do you think can influence these policies?
There's one more thing that I can add, but in terms of influencing, I think one thing that in my local context, mainly young people really could, because in Sri Lanka, the recent experience is that we have like basically a bunch of young people got together and toppled the government, and it went same for Bangladesh very recently. So there's a lot young people can do, but it's that there's a disconnect between that power that young people have in mobilizing in the ground versus when you really come to policy level or the political level, the legislative level. So influencing, so in between, we are the people who sit in between. We could potentially make that connection. So young people for sure. And also, I really do believe in civil society and activists, feminist activists in influencing. In Sri Lanka, specific, very small example on making sure that I work closely with the deaf community in Sri Lanka. And when I first started working with the health ministry in Sri Lanka, they had no idea what to do, like what sort of inclusivity that they have to think about if and when they include the deaf community into their equation. So after I came in, they are more sensitive. So small things like that, like we can, as people who sometimes people living in the grassroots don't have access to that upper level. So we definitely, as the civil society, international and local, do have a really big role to play and a big voice. So that is definitely young people for sure, because governments in my part of the world, I would say, now have learned to fear young people to a certain extent. I don't know whether it's good or bad, but the experience is that they really can do a lot. And in terms of a recommendation, one other thing that we're noticing in the past is there's incoherence between the law, the policy, and how the combination of this is being implemented in the grassroots. What lacks is public consultation, because you are drafting policies, drafting laws for a constituency of people and coming from different communities. If you don't ask them what they need and just go ahead and do policies and laws, then that's not going to work. So that public consultation and making sure that laws match the policies, reflect the needs of the communities it's really.
Thank you, Shelani. I just want to jump in and say that, yes, I agree. Young people, civil society, feminists, and are important stakeholders that have so much at stake here and can drive or influence policy. But I think we should also actively take up space, be it leadership positions, government positions, so that we could influence them. Or how do we also get into those spaces, whether or not we have like actual elected seats, but how can we influence those who are in power with the knowledge, our realities, and our principles and values as feminists and young people? So again, thank you so much, Riju, Shelani, and Shift, for joining this podcast. Just one last question before we end. Just in one word, how would you describe pleasure? When you think about pleasure, what is that one word that comes to your mind? Just so we can end our podcast on a light note. But again, thank you for joining us. So who wants to start?
I can go.
Okay.
I think it's empowering.
Empowering.
For me, it's, I don't know, the first word that popped into my head is fluffy.
Fluffy.
Yes, it's tied to very personal experiences. So, like, fluffy would be the word that I would use to experience as a experience.
Now I think about like, clouds as like fluffy.
Yeah.
And Shiprah?
Yeah, I think pleasure is fun. And we all have a right to fun.
I agree 100%. I think that's a really good way to end this. Pleasure is fluffy, should be something fun and empowering. And we all deserve to have some pleasure in our lives, in however way we find pleasure and define pleasure. And I think pleasure is power. So thank you again for joining our podcast for today. And it is our hope that through our conversations on the right to pleasure, we will eventually remove the awkward and the anonymous when we talk about pleasure and our SRHR. So thank you and have a great rest of the day.